Hi, and welcome to my channel. My name is Dr. Ellen Wesley. I'm an emergency medicine physician in Chicago, and this is Dr. Ellen's Best Medicine. My purpose with this channel is to enhance your life. It is to enlighten and empower. I would love very much to get rid of a lot of the panic that's going away right now. And my understanding is that good information is the best way to allay panic. Now, fear is very normal and fear is very healthy. Panic is just a waste of energy. I'm posting ultimately twice a week, but lately I've been putting something up every other day or so. There's just so much in the news now and so much panic, and I think it's really important to share as much information as we can. A couple of questions that people, so this is an update. This is Friday, March 27th, 2020. One of the questions that came up today when I was talking to a friend was, again, because I'm in between shifts and I'm going stir crazy, so I always need a project. That helps. I was talking to a friend, and the question is, how do I know if I have it? How do I know if I have coronavirus? Well, there's a wide range of symptoms and clinical presentations. Some people, like you're hearing on the news, don't have any symptoms at all. May or may not have a fever. Some people, generally what I would be thinking, what I see is people that have general malaise, just don't feel great, achy all over, a fever, dry cough. Sometimes people get abdominal pain, sometimes diarrhea. What I'm seeing most often is a little bit of a fever, generally just feeling unwell. The people that get sickest with this illness are the people that get sick rapidly, particularly difficulty breathing. Dry cough in itself is not a cause for alarm, but the people that get the sickest progress over the period of about 12 hours, and they notice they have difficulty breathing. What happens in the lungs is that this bug creates edema of the lungs. If you think about the lungs sort of as though they were sponges, lungs with extra fluid in them in that way are like wet sponges. And the danger comes, the heaviness on the chest comes because a person has to breathe against a heavy lung because it's waterlogged basically. This can progress to a condition called ARDS. Dangerous, but again, it will do that over a period of several hours. You will know, you will feel very sick. Other than that, if you are not having difficulty breathing, stay home. Stay home. We treat this the way we treat viral illnesses in general. In general, the treatment is geared toward the symptoms, and it is we treat the symptoms. Again, difficulty breathing, go to the hospital. Now, another question, do I need a test? People are rushing to get tests, and I need to tell you, the reason to get a test is not for you. It is for people with whom you might come into contact. Having a positive test, knowing that if you have coronavirus, is not going to affect what we know about how to treat you. What we know about how to treat you is based on how you feel. No different whether you have a positive test or not. Again, the tests are to protect those around you. Now, another question, should I wash my boxes? No. There was a wonderful presentation last night on Instagram. Trevor Noah interviewed Dr. Anthony Fauci. That was good information. He's a grounded guy. The interaction was relaxed and about as devoid of politics, I think, as you might find. And that's the kind of thing that I would rely heavily on. You know, be really, really careful. So, and Dr. Fauci talks about whether or not to wash your packages in that interview. We know that, you know, if somebody coughs on you, the concentration of virus and cough particles and the velocity, how fast those things go when someone coughs on you, that's a big risk. There are some microscopic particles with virus that will stay suspended in the air for a short period of time. They will. The most important part about how this is spread is on surfaces. Those microscopic particles from people's speech, from people's coughing, they drop and they're in the air for a little while, but when they drop on a surface, the virus is active on that surface. On cardboard, on boxes, cardboard, that kind of stuff, it really doesn't stay maximum for a day. But, you know, even a box from China, it's been in transit a long time. No, you don't need to wash it. You'd be more likely to contact, more than getting virus off a cardboard box would be from getting virus off whatever it was you picked up to wash off the box with. Does that make sense? Okay, another question. What scares the emergency room doctors? Well, you've been hearing a lot of talk about ventilators, and what scares me is not being able to help a patient. What scares me is having to look at a patient and know that I have the skill to help them, but I don't have the equipment to do it with. In those situations where we don't have ventilators, I don't want to be in the position to watch someone die. That's what's happening because of not having enough ventilators. I don't want to be in the position of deciding who lives and who dies, and that's part of our job as triage emergency physicians. So that's what scares me, that's what scares us. Wash your hands. Remember, don't go to the doctor unless there's something that the doctor needs to treat. Also remember, I am not your doctor, and this is for informative purposes. This is to give you a little embellishment on what you're picking up from the news. Anyway, I'm Dr. Ellen, over and out. Thanks so much for checking in.